Hello, I'm Dr. Max Gomez. I've been a medical journalist for more than 27 years now, a good number of them right here in Philadelphia. During perhaps thousands of reports on cancer research and treatment, I've watched the field change and evolve so dramatically that it can only be called a revolution. We're moving beyond the traditional approach of surgery, radiation, and chemotherapy. The new world of cancer treatment is one of targeted therapies, drugs designed to strike at the very heart of a cancer cell's unique characteristics. Now, it's exciting and important to be on the cutting edge of research, as Jefferson's Kimmel Cancer Center is known to be. But what makes the Kimmel Cancer Center truly unique is how it translates that research strength for the patient's benefit, moving the best science from the benchtop to the bedside. And it's how the doctors, nurses, and technicians at the Kimmel Cancer Center deliver that care that sets them apart. Patients and their families remember and appreciate the compassion and sensitivity shown them by the entire Kimmel team at what just may be the most trying time in their lives. Compassionate, state-of-the-art care. That's the Kimmel Cancer Center.
There are about 25 million Americans right now who have cancer and don't know it, and there are about 10 million cancer survivors. So together we have a huge responsibility to improve the quality of life for our patients.
We're now able to bring together the clinical resources of medical oncology, radiation therapy, surgical oncology in a single setting for the treatment of our patients that is immediately connected to the research environment for those same processes and those same patients.
The Kimmel Cancer Center for me really is about bringing different people together, all focused on the same thing, creating a better care environment for our patients and creating better care for our patients.
I think of cancer, especially a diagnosis of cancer, and especially a diagnosis of breast cancer, as like an out-of-body experience. It's not you, it's somebody you know or somebody you've heard about, a sibling, but not you. And in fact, it is you. And when you come to terms with that, you go through what I call a journey. And you take it step by step, and you come out the other side, believe it or not, stronger than you ever were in the first place. And the people at Kimmel Cancer Center really encouraged me as I went through this journey. They gave me certainly the cutting edge care I needed, but they also gave me the emotional care I needed, which was very important for a cancer survivor.
I've been often asked what's the biggest hit I've ever had in my life, and probably the biggest hit I ever had was when I got the call from Dr. Scott Goldstein from Jefferson that I had cancer, and my wife Janet's there with me, and it was like the wind was just sucked right out of my body. I said, there's no way, how can I have that? I mean, you kidding me? It's impossible, I feel too good. I don't have any signs, there's no symptoms. And I had it, and the thing was I wanted to go to a teaching university, I wanted to go to a teaching hospital, and there was no best than Jeff. They saved my life, and it was a great experience.
I would not want to have cancer, but I think if I had to go through it again, I definitely would choose the Jefferson Hospital. I definitely would want my same team of doctors, although I'm sure any team of doctors at the Jefferson would be good.
When I learned that I had breast cancer, I was 32 years old and I was 5.5 months pregnant, so I was scared to death because I had 2 other children at home and an unborn child. At Kimmel Cancer Center, they had my best interest at heart. Their first concern was my survival, bringing my baby into the world. Stephen to me is a miracle child.
Personally, my father has been a patient of the Kimmel Cancer Center, had colon cancer, diagnosed 8 or 9 years ago, stage 3, and he is still with me today and doing just great because of the kind of care and the kind of attention he got at the Jefferson Kimmel Cancer Center.
We know how to cure cancer. For the first time, we know what questions need to be asked, the experiments that need to be done to get the answers, then how to design the targeted drugs and interventions that will lead to a cure, or turn cancer into a chronic treatable disease rather than the killer it is today. Almost as exciting is how we've learned to tell the difference between different types of cancer, to fingerprint a cancer cell, if you will. All of this brings us back to you. Today, you have a rare opportunity to become a part of history, to actually help cure cancer. We're on the brink of a turning point, but we need your help to make it happen. I hope you'll agree that this is an incredibly exciting opportunity in cancer care and treatment. You can help make a difference. Please join us in our mission.
Well, the Kimmel Cancer Center is focused on transformational discoveries, those that can completely change the outcome of this disease. Now, I absolutely believe that the cure for many cancers are at hand. We have never known so much about cancer as we do today, and we want to harness those current discoveries and move them as rapidly as possible into the clinic to help our patients. And believe me, if we can get these current discoveries into the clinic fast, we can save lives. There's never been a time like there is today in which the new funds that come into the Cancer Centre can affect the life of patients. So in essence, raising funds for the Cancer Centre is about giving life to people. There could be no more perfect cause to be involved with.
What we want to make sure here is that cancer isn't a death sentence, it's a word. And the only way it's just going to become a word is going to become that through research. And that's why donations and investing in the Kimmel Cancer Center is so important. It's the research to try different techniques, it's the search to find a cure. And that's the dream that we all have right now, you know, and where people are saying that dreamers aren't doers, well, we're doing it right now, you know, because the rate of curing is that much higher. So it's about helping people develop with their potential and giving them the opportunity to live a healthy life. So make your investment in Kimmel because it's going to be perhaps one of the greatest investments you could ever make.